Today I'm going to show you how we perform prolotherapy of the knee. Floyd is going to be performing prolotherapy on this patient's right knee. He has a little bit of arthritis on the medial part of his knee. He also has some meniscal damage, so he's having a lot of pain in the medial knee component. We're going to show you how we treat the whole knee. We're going to treat the joint on the inside, we're going to treat the ligaments on both sides, and we're going to treat the meniscus. So first we're just going to clean up the knee. We're going to make sure the knee is sterile, so we're using a sterilizing solution. We also have a sterile field set up that will make sure that this procedure is safe and clean. So Floyd is going to numb up the areas that are going to be injected. We're using a little bit of lidocaine into the skin and into some of the structures, and that's going to make sure that the procedure is well tolerated. So the patient has some fluid in his knee joint. As you can see on the ultrasound, here's a lot of fluid, which is that black part right there. What Floyd is going to do is going to put a needle inside that joint, as you're going to see it entering right there, and he's going to withdraw some of that fluid. Basically, we want to remove some of that inflammatory fluid that's in there. That fluid is irritating to the joint, so Floyd is going to take it out, and then we're going to go ahead and put some prolotherapy in the joint, which is going to start healing that whole structure. All right, so Floyd removed a lot of that fluid from the knee joint. Now you can see him actually injecting the prolotherapy. Here's the needle, and you can see the prolotherapy solution going inside the knee joint capsule. And this is going to help the knee joint feel better, and it's going to help to heal some of the structures. So now that the joint has been treated with the prolotherapy solution, Floyd is going to start treating some of the extra-articular structures. So he's going to go ahead and treat the MCL. Here's the medial collateral ligament that you can see on the ultrasound. He's going to go ahead and inject that with the prolotherapy. You can actually see the solution spreading into the ligament, and that's going to make that ligament nice and strong and thick, and it's going to help to protect that joint. So you can see all of that spreading all the way right there. He will also inject the meniscus. Here you can see on the ultrasound, here's the medial meniscus, and we're going to see his needle go towards that meniscus. And you can actually see the needle tip right in here, working its way towards the medial meniscus, and then injections going in. And you can see the fluid spreading right around. There you go. You can see the needle tip, and here's the prolotherapy solutions around that meniscus. So you can see Floyd is doing injections of the inner part of the kneecap. That's where some of the ligaments and tendons attach. That will help to stabilize that patella. So right now you can see Floyd is injecting the lateral collateral ligament. Here's his needle, here's the fibular head, and here's the lateral collateral ligament. And you can see the injection very nicely spreading right around that ligament. Perfect, beautiful. All right, so we are done with the prolotherapy procedure of the knee. Floyd injected all the structures around the knee, the medial collateral ligament, the lateral collateral ligament, the joint inside, and then the kneecap. So now the patient's going to go home and heal, and hopefully within a couple weeks he's going to start feeling much better.